development on the program in Saudi Arabia if we're doing more and more research and more, especially for infection disease in the Middle East. We have more infection disease, especially hepatitis, tuberculosis, for the donor side. Fortunately, we don't have this kind of lawsuit, or a lot of lawsuit in the United States against kidney or transfer infection disease from the donor to the recipient. Thank you.
Thank you very much, Dr. Saleh. Now, discussion is open to the audience on the 3 talks or anything to do with the organ donation and transplantation in the GCC countries. Yes?
2 suggestions for the Scott Center, Dr. Faissal. They are not new, but I remember we discussed them, at least one of them years ago. The first one, I think we need to move forward for organ allocation to patient-based rather than center-based. The fact that now that reducing HLA mismatch and our role in extending the half-life of our grafts that are transplanted means that really organs should be patient-based. I know there are politics here, centers will competition, but there can be payback and to alleviate the noise of some centers. So we have the registry, it needs to be rectified, but from that registry, can we advance it to allow patient-based organ allocation? The other point, proceed or wait for the...
Wait, I'm old man. I will not remember all what you said. Just to give me a chance to answer you. I think again we have the 2 combined system in one. So we have what's known as national waiting list, and we have local waiting list. And you suppose if you receive a center, a kidney, you're supposed to do it according to the highest or to the good match between your recipients. So it is the patient still. We are working about the patients, but it is probably a small number of patients, so you will not have a very good match. If the organ is increased and we don't have such competition, everyone wants to take the others, probably we will move to the national one. We will give it to the best match. And myself, I didn't think that there's a big difference. Even the research can show that the difference is very minimal, especially if I have in my centers, my own center, apart from Scott, I have around 600 patients on dialysis. And I'm sure that when I get a kidney, this is only one center, and I'm supposed to have also affiliated hospital which belong to me. So I am catching for one donor I can match with so many other patients, maybe 10, 15 patients, and I take the best one of them. But you are okay. If you have, let us say, if we reach to 300 donors a year or something, probably we have to change the system. But the system which we are in keep us at least relaxed from the competition between the centers.
Dr. Faissal, they are reaching zero mismatch 15 to 20% elsewhere in some countries. Now, when we talk about hospital levels, zero mismatch, I think it's a rare finding. So there is difference in, if we talk about HLA mismatch and chronic rejection as the main reason for organ loss, then matching patient at a center level will never reach the values of at country level.
Okay, sorry, I will expand this more a little bit. Now, again, I'm still thinking that it is very unfair to compare Tabuk area and Khamis Meshet area and with a small number of patients, and to compare it to Riyadh and Jeddah, which have a huge number of patients. So if I make it patient driven, this means that I have to close that centers because the chance to get the kidney, it will be very low because of the small number of patients. So I have to close at least 6 of those centers which have a very small number of patients. But, and also, as I mentioned to you, one center only have 600 or 700, which is my center, again. If I make it like this, and the best match, probably I will be myself and King Faisal, the only 2 centers, and maybe National Guard, to some extent military, 1 military hostel, to some extent working, and the other will not work, will not at least take a kidney, except very rare to have it. As I mentioned before, we still am insisting about this. Future-wise, if we have more donors, we can implement this, because
Okay.
I will be sure that each center will work.
I think the point has become clear, and we want to make it general on the GCC. What is your second question?
The second point also, an old discussion that it's mentioned yesterday how the Chinese overcome the problem of people acceptance of brain death principle by controlled brain death. Now, for a long time, I think we have a difficulty in some of Arabic countries to accept the brain death principle. And we can set a model in the kingdom by starting DCD, at least control DCD, patient with brain death going to DCD, controlled approach, or expected death controlled and controlled DCD. The idea, first, we will gain overcome a lot of hesitancy of some people who are not accepting brain death principle, and this is present in our community, and set example for the rest of the Arabic countries who have the religious attitude toward the brain death principle by this approach.
DCD program is very important program, and I think we should start it. This is one of the door which we don't open. But there's a committee in Scott discussing this and agree about this, and we raise it even up to a high level in order to start DCD. In my own view, I think we should start it in a few hostels, not in every hostel. And still, because I know the cultures here, if I have a brain, this case, this donor, and I told the family that this donor is medically and by religious considered to be dead, and I want their organ. My target is very simple. But if I have one is going to die and he's in a terminal case, the family always have hope that some miracle could happen to them. It will not be easy as you think, but we are going to open this door in the future, and already myself, I think we will put 2 or 3 hostels starting doing DCD, and then we can implement it for all the country.
Very good. Yes?
I would congratulate all of you, people in the panel and in the audience, congratulate on this excellent conference. I'm an obstetrician gynecologist, the only other obstetrician who participated in this Congress. I like to take a cue from the 3 speakers. Number 1, from Tim, he said, invest in yourself. Number 2 is from Muhammad, who said, aim high and move towards funding and governance and try to abolish ego. And the third one, from Professor Faissal himself, asking for a generous, unlimited collaboration. One of the things I like to mention in this transplant conference is that we should harvest technological advances up to date and transplant them as digital facilitation of ourselves. And that's the most important thing today. And that will overcome most of these difficulties that we have at this moment. In fact, communication should be important. We should accumulate experience and translate it into evidence, and this evidence into best practice. and a globally uniform practice must be started off, and I think it is going on, and eventually it will, I think the organ transplantation group will, I think, achieve it very soon indeed. I will wish all the best to all of you. Thank you very much.
Thank you. We'll take this as a comment and then we'll probably answer it back. There's a question there.
Excuse me, I want to ask about the role of the private section in donation and in transplantation in all GCC countries.
Mona, would you like to take this question? Private segment in transplantation?
We only have government available in the Emirates, and it's only in
think-
Abu
do you-
Dhabi also,
do you
because
think-
we are 7 Emirates.
Yeah, do you think the private should be allowed to go into transplantation and organ donation?
Maybe in the future, but not for the time being. Yes.
Dr. Faissal has got a good experience on that, and I know his view on that as well.
Private, first we should have a center to supervise all the transplantation, like what we have here in the Kingdom of Scott. And no private sector should do any transplantation except after taking permission from the main center, which is like Scott. And this should be implemented in all GCC countries. If we allow anyone to do any transplantations, this is the bridge to go immediately to commercialism, and it is very difficult. This is one point. The second, we have ruled to enroll that the private sector in transplantation. In Saudi Arabia, we have a couple of hospitals which they are performing transplantation under the supervision of Scott. So private sector is still very important, but should be supervised. And from our point, in our policy, private can do living-related transplantations, and they should have acceptance from Scott about any living unrelated which is not having or not going to be having except after permission from Scott through the committee, and from deceased donations to encourage them to work with us. If they have a deceased donor, one kidney can go to their waiting list and the other kidney go to the national list, and the others can be taken. So it should be under supervision, not because of trust, but again, still the private is the private. They need money, they need to have income, and we don't like to bridge to commercialism by any way.
Thank you. More questions from the ladies' side? Any more questions? Okay.
Yes, thank you, Dr. Musa. Well, I've got a few points. One is your idea about the expatriates. I think it's excellent. I think when we talk about numbers, for example, as per media, in Saudi Arabia, 1/3, almost 8 million, that's 1/3 makes 8 million. So 8 million is a big number. And if you and Kuwait started this program and proved to be successful, I think you can infect other GCC countries. I think please go ahead with that program. Probably we should start something like this on a limited scale. Other things about the research is Dr. Muhammad Al-Sayed, he mentioned a couple of things. He said open doors, don't recommend that one center to do one thing. Please make sure the door is open for others, because sometimes there might be some bright guy somewhere else. And he was talking about the researches and funding. I think he had to add one point, which is the limitation of time, because I remember in the middle 80s, when we were doing some researches, we had to spend months and months to get approval. Now, I will go fast. The activities, Tim, he mentioned about to appoint, like, for example, the Spanish, where they have somebody in the hospital. I think we have something like this as regional areas. But what we have to do is probably stimulate that guy to work harder. I think the last thing for Dr. Faissal, in one of his slides, he mentioned that we have 50 livers. We need 50 livers and we are having 15. So if we have 15 livers, we should have 30 kidneys. Now you mentioned 20 used. Where are the other 10? What did you do with the other 10? Thank you.
I just answer you this. I said every 15 liver needed, we have this, and every whatever 200 kidney, we have 8 needed.
Yeah, I know needed, but I thought you have
No.
done 15, so I said then the other 20,
No, no,
20 then
no,
10 is
no,
gone somewhere else.
No, no.
Okay, thanks.
Okay.
We have a few more minutes. I just want to raise a question regarding the inactivity or unsustainability of transplantation in some of the GCC countries. As you know, I think Saudi Arabia is the only country is that not only well established, they have an organ procurement center which is very active, and they have a persistent program, whereas the programs in other countries are ups and downs. Of course, Kuwait is also one of the active centers, but still we have some difficulty in getting the government interested in organ procurement and provided funding, which is extremely important. And I think Faisal mentioned this in his one of the last slide or the slide before last, that to get the government attention and funding is important. Faisal, what can we do to get the attention of the other governments such as UAE, Oman, and Bahrain to really be interested in transplantation and provide the funding, and even the Kuwaiti government to provide the funding required for organ procurement, something that we are lacking in Kuwait. Can we, for example, send through the GCC Transplant Committee a group to go and meet the different officials, because unless you meet them, you cannot get them interested. What do you think of that?
Thank you, Mustafa. I think the time will come very soon that those governments will hear what we said, because the pressures they will have from the patient, it will be very tremendous. Before they have some ways to send their patients in some countries by official agreement between the two countries to send to them patients to get transplant. Now those official agreement is not anymore existing, and that's why the first things is the pressures from the patient, and they should do something in their own country, and this is I start to notice it in some countries they started to have their own program. Second, this is our responsibility again, and GCC to write to them after this Congress that we have to do some changes. We have to have organ centers. You have to give budget for those people to work. We have to show to them what's the difference in not to having transplant center and to depend about others, which is not existing anymore. Some of those, they are sleeping actually. They think that, okay, any patient who is sick, I send him anywhere, he will get transplant, come back again. And also the patient started to use this as to take money and not even go for transplant. And this should be stopped. In Saudi Arabia, we take some actions against this, very strong actions. So no single real given to any patient going abroad.
Okay, we have two minutes, and we'll allocate it for Professor Auniski, who's been a regular visitor to many of the GCC countries, so he knows all the problems that we suffer from. Please, Professor Auniski.
Thank you very much. Wouldn't you think that the letter from WHO to governments of GCC countries, instead of you, Scott, or individual persons writing the letter, be better? I think the letter from WHO would help. And the question is to Dr. Faissal. Faissal, tell me, having so many living donor kidney transplants, do you have the registry of the donors, or are you thinking of having it?
We had the registry of donors, and we are following registry of donor according to WHO rules. Since 2 years, we started to make it as one of the prerequisites to accept the donor is to have a donor registry and follow-up of the donor as well.
Regarding your first part of the first question, that if WHO writes a letter, well, I think they can write many letters, but many of the governments or the officials will probably put it in the drawer. Unless you go and persist and you talk to them directly, nothing would be achieved. This is my feeling. I don't know whether it's the feeling of the others. Asa, do you think this will help in your country to impress the to impress the officials?
Well, I think with sorry, a combination of the two would work probably better. As far as I know, Oman is very well in collaboration with WHO, and they always do listen, and there are quite a number of programs run with the collaboration WHO and the Sultanate. But definitely at the regional level, and in particular with the kingdom here, a good sort of support and a visit will have its positive impact, definitely.
Okay, Mona?
I agree with Isa. I agree with Isa. In fact, they will respond better to the WHO than...
Dr. Saleh, do you have any comments?
It's different subjects.
Your microphone is not working?
In different subjects, please, this one now. I would like to have 1 minute or 1 second about sharing organ by tissue typing and mismatching and matching. For the last 10 years, 15 years, I'm so against matching and mismatching and all this data published by UCLA and UNOS. It's like 20 years ago, and still the world working and follows this system. I don't know if anybody has comment about this, or Dr. Faissal Shaheen. Mismatching is complicate our life and all our kidney transplantation by this mismatching and matching. I'm against, and all this data published by UNOS. It's old data, and I was part of this publication. I don't know if Dr. Faissal do you have, because we don't need to follow exactly what United States or what European doing, because changing the system in United States takes maybe 10 years to change 5 match for a match or mismatching. I don't know if Dr. Faissal, do you have your own way sharing organ, or no, especially for matching and tissue typing?
Okay, a comment from Dr. Faissal and we'll end the discussion.
I answered Dr. Nasser. He meant by his question the same about matching and mismatching, and to have a good match better than to have less match, and this will affect the long-term survival of the graft. And I said the same thing, that this is the future, while we will implement this when we have enough donors.
Thank you very much for your participation, and I would like to thank all members of the panel. And now I think Dr. Faissal will give the final closing remarks of the Congress.
Again, as we promised that we will finish very quickly, and I will try to finish very, very quickly as well. I don't know what to say, that I did nothing in this Congress. All what you saw, I wasn't even attending the meeting of the Congress. There are many people who work very hard, day and night. Many ladies coming and leave their home and work in this Congress, and I should appreciate them. Even in the weekend, Saudi ladies, many of them were working in Scott in order to make a success of this Congress, and I was very happy, very proud of everyone in Scott. I am sure that I did probably 1% of the work. The rest of the work goes to my colleague, my friend, which they make this Congress very successful. And I don't like to mention names, but again, it hurt me not to mention a very special name like Abdullah Khidr, Abdullah Sayyad. Abdullah, he did a great job. And he's not with us probably now, but I will never forget his work. He worked day and night for his scientific program Merit. I never will forget what my deputy did, Dr. Abdullah Mahfouz. He did a great job. He actually was sometimes even stay in the office in the day until very late night and come very early morning. And I know that he had family commitment, which even he forget about and work hard. Dr. Bishar Attar, he did amazing work in order to make this successful meeting. The team of one of very important leaders in Scott is Mr. Abdul Karim Al-Jasir. He's a very famous guy in the TV every day, but he ignored all of this. And I know that he could have win a lot of money when he go to ART or somewhere about Al-Hilal, and he's very important man in Al-Hilal team in Saudi Arabia, and Al-Hilal is known. I'm sure that most of you are known this. I'm not against Hilal, but he's a Hilal man here. He did a lot with his team. His team is Al-Adaibi, his team is Hanan. You can see her everywhere. We have a lady, which is a hidden lady, her name is Aida. She did a lot of work, day and night. She is working. And she asked for more work. She brought her sister from home. There are many people who take everything. He wants to facilitate for everyone. He doesn't like to miss. They don't like anyone to miss anything. Al-Ghamdi, Abdurrahman Al-Ghamdi, Saleh Al-Shihri, another Ghamdi, which maybe no one see him, but he is working. He went to many places in order to facilitate visa and to facilitate the work. Every single one in Scott working very, very hard. I appreciate what they did. And I'm sure that all of them, I hope that, I know that many of them, like medical department with all different people, I cannot just name that Muhammad, Dr. Ziyad, Suqiyya, there are many doctors. Everyone work hard, every single one. They did their work, they did their job in a very perfect way. I notice all of this as someone from above do nothing, and they are doing the work. They did their job. I never forgot our ladies which come at night working, and secretary, working anything. This Congress done by hand of the people. We didn't depend about companies to do it. We depend mainly about our personnel, about their efficiency. I know that they are very efficient to do that. And I am very grateful for every one of them. As I said before, I was in, just an example, I was in a Congress in Vienna. I stayed one day to attend the first day of the Congress. It's about Pharisees, and I'm interested in this, so I went there for one day, and they said, no. One of my old lady, she's 85 years now. She was the head nurse when I worked with her. And she was very happy to see me and told me, Faisal, you come and I invite you today. I said, I'm sorry, I should leave. And she said, why you leave? You just arrived last night. I said, yes, I already finished my work. I have to leave because I have a big Congress in Saudi, and I have to return back. And she has answered me immediately, you are the boss. The boss do nothing. Don't tell me that you are going to work. They will do for you. And this is really what's happened. They did all the job. I'm sure that there are many names, many people work very hard in this Congress from ourselves. I will now go to the scientific point. I will leave this emotional thing because if I start to continue, I will cry maybe. So I just go for the scientific thing to give some closing remark. Dr. Sayari is supposed to do this, not me. Again, I don't know for reasons that he insists not to show himself all in the podium here, and that's why he gave it to me. So if there is anything, please just forgive me and put it in the hand of Sayari. As I said, I did nothing, they did everything. So I just give you overview about the Congress. We have 4 days activities being accredited by 30 CME. We have 12 international speakers, 4 to 4 from GCC countries and Arab countries. We have a good, probably good scientific program. Our attendance is more than 1,000 attendance from 25 countries. We sponsor 17 companies sponsors the meeting and the exhibitions, and we have volunteers from different places actually. This is a very important issue which I didn't mention. I am very thankful for some people who helped us, the medical student which helped us, who was named Waman Ahyaha. They are so great. Maybe you saw that some of them, they work from hard, they did a lot of work, and I appreciate their work. They are from King Saud University, and the number of them of 15 medical students. We have help from Ethar and as I mentioned, Waman Ahyaha. Now we go to what we did. We did a pre-Congress work was about HLA and immunology, and we have organ procurement, and we have job study. This was on Monday. And then we go to very important issue, which I should mention one by one, that we learned something in this Congress. In the opening ceremony, Dr. Al-Gawi, he gave a scientific base of which the Islamic scholar decided for permissible of organ donation. Myself, I think this is one of the very important issue. And after his talk, so many people asked that we should have Al-Gawi to go around and speak with us about this, because this is a very important issue. We learned a lot from him. We learned a brilliant lectures from Dr. Zeda. I like him very much, by the way. And the best things which I like and from what he said, probably it is because I am overweight, and he said that obesity is good. And this is, I never know it before. He mentioned clearly that if you are obese and you have chronic kidney disease, you live more than when you are thin and you have chronic kidney disease. So at least we have some reservoir if we develop chronic kidney disease. I like what he said, and it is new, and he proved it to me, and that's why I'm not going to lose any weight after that. That's just for the future. You know, Domenico, he did a lot of work, no doubt that a lot of talk, and he is everywhere. He was brilliant about what he said, and I learned from him a lot. Resvi is my friend, and Professor Resvi, he reflects the concept and the possible to increase the number of transplantation, which we needed. This is something that we needed in our country. I think we should work more in order to increase living donations, which is very important. And Professor Ghanem, he is my teacher. He was excellent. He shows that we are in Arab can do something. He did something with his research in rats about insulin. And I think probably future-wise we can have something coming from Mansoura University against diabetes mellitus. It was amazing lecture. Tim Brewy, he shows to us a lot of things about transplantation, especially the infectious diseases and transmissions of the infectious disease and malignancy, and the methodology to reduce it. I think this is what we need. We're still lacking of such things to be accurate. We still need more accurate information about the donor. Professor Rawaniski, as usual, he was amazing in giving his talk about ECD, and he shows to us that 40% we can have increase from the deceased donations, and this is, we need it again in our country, and this is the door which is not opened. We should open such a door. We learn something in this Congress. Al-Haydari, when he spoke about GCC, we are very proud that he mentioned clearly that we are the best committee in GCC. All the committees have a lot of, we are the best, not from 2 or 3, maybe they have almost 35 committees. So we are the best, which is show that to reflect how we are working hard since a very long time. Today we have a discussion about GCC organ transplant and how to improvement. And also we heard Dr. Hajir about the importance of BRA, where Dr. Kafuri again about the nephropathology, and we heard about Islam and fasting and GCC and what we need, and all of this is very important issue. This is what we need to learn, and we don't like to accept a lot of free communication from the start, but we wanted to give something for us to be learned about. The problem of allograft rejections and T-cell stimulation, this again was very important issue, and it is being discussed during this Congress. Pregnancy from Dr. Kadri and Dr. Ghamdi also being discussed in this Congress, which is important for transplantation. Professor Saeed today, he was amazing as usual, and he spoke about immunology with Dr. Mashari and so many of them. All of this was important for us. I'm sure that there are so many people, so many attendants, which they are brilliant speakers, but we don't have chance to put them in the program. And I'm sorry for that. But their presence was very important for me as a brother to them and for the Congress, because this will give a Congress another image that brilliant people being speaker everywhere in the world, they are coming to attend our Congress. I know that maybe 90% of them, they are coming because they are my friend. But I appreciate all of you that you stay with us till today, till this moment, for this closing ceremony. And thank you very much, and I hope to see you in the next meeting.
On behalf of all the speakers and the guests and all the participants in this Congress, I would like also to thank Dr. Faissal Shaheen and his team. And of course, Dr. Faissal, without your leadership, I think there wouldn't be such an excellent organization, an excellent Congress with a very good attendance since the last session. I would like to thank you and your team for an excellent work, and hope to see you all in the next Congress of the GCC. We still haven't decided which country and when, but we'll let you know, inshallah. Thank you very much.